for the warm introductions. Good morning, distinguished guests, partners, and friends. I think that I'm quite touched for the opportunity to listen, learn, as well as share as we co-create around this, this agenda. I would also like to obviously single out eHealth Africa for convening this important discussion. And I think this discussion is timely and relevant, particularly as we, as a government, transition towards supporting subnational action, particularly around the themes that, that the Learning Forum will be touching on today. But I wanted to do a couple of things as part of this opening remark. For me, the first thing is to ensure that we're not speaking in terms, that we lay the foundation for what we would like digital to respond to. So I would like, over the next few minutes, to lay out the important problem statements as we see it through the lens of the reforms that we're advancing. And I think to do that, I'll have to provide some context. I think we've heard a lot about the problems. We're not necessarily happy with where we are. Health outcomes are poor. We have suboptimal quality of care. We also recognize that despite significant investments that we have seen in the health sector, we are not, not seeing the sorts of results that are, that are equitable. And we think this is not as a result of a technical or even financing problem, that it's more around a governance problem and one around important enablers such as digital and the role that it can play to allow us accelerate improvement in health outcomes. I think a couple of years ago, when we came into government under the leadership of the Coordinating Minister of Health and Social Welfare, we undertook a rapid diagnostic. And I think some of the underlying structural issues in the health sector, everything from the market asymmetries that we have in the health sector, information asymmetry, hyperfragmentation, issues around data, deficits in terms of the production and deployment in terms of human resource, issues particularly around important kind of systemic enablers. So the issues are well known, but we have, as a result, developed an agenda around dramatically reducing maternal and newborn mortality through a Nigeria Renewal investment initiative. And this was the basis of the 4 pillars. And the first is really around governance, responding to the issues around governance, because there's significant fragmentation between federal, states, local government, between government and the private sector. And we harnessed a compact, a swap compact, where Mr. President and the ministers signed with all state governors that will be the basis of our North Star. And it includes important elements such as aspirations to revitalize primary healthcare centers, currently about 8,800 BHCPF facilities, and we have an aspiration to make them more functional, to go from level 1 to level 2 functionality, and then to double those. We have targets around CMONC facilities, in them to a standard where they can deliver comprehensive and advanced care. There are important levers around emergency services, referral linkages, the deployment of community healthcare workers, and several other themes, particularly digital as well. And in implementing these reforms, we have identified important principles through a sector-wide approach. And they include things like country ownership, government leadership, and we tagged important themes around one plan, one budget, one report, and one conversation, just so that as federal, states, private sector, all stakeholders rowing in the same direction. And we hope that these important components will allow us to dramatically crash maternal and neonatal mortality. As part of this plan, we have, under one plan, identified digital in health as one of 11 priorities. And in fact, as a result, we have digital as one of the important incentives or hooks that we are prioritizing and mobilizing resources around. I think so far we've mobilized over $1 billion through a performance for results kind of instrument, where we are incentivizing states to focus on these priorities and rewarding them accordingly. So for too long, digital health has been treated as a series of siloed projects. But under the Nigeria Health Sector Renewal Investment Initiative, we are clear digital infrastructure is as essential as our clinics, as our human resource. And as a result, we have kind of put it as one of our important priorities. It is an important cross-cutting enabler that will ensure effective governance, that will enhance the stewardship of our health system, both on the supply and demand side, that would help drive quality through better data intelligence, that would help to unlock efficiencies and secure our nations through real-time surveillance. And so the Nigeria Digital in Health Initiative was tasked with building this foundation through the Nigeria Digital Health Architecture. We are laying the digital highways that will connect every part of our ecosystem. And I think as we think through the digital in health architecture, it's important to highlight the important use cases that we are seeing. And there are a few things I want to highlight. The first is that we have identified 172 local governments that represent nearly 55 to 60% of where the maternal deaths come from. So one of the important problem statements that we're thinking about is, as we create a bespoke intervention to save lives within these local governments, from the BMONC to CMONC revitalization to the deployment of community healthcare workers, what is the role of digital to enhance the origination of demand creation, the referrals, to save lives? So I think that's an important thing to consider. The second is really around the role of digital in our HOPE PHC operations. I mean, ultimately, the Nigeria Health Sector Renewal Investment Initiative has an accountability framework, and I think the role of data intelligence to support our state performance dialogues for surveillance in terms of health security at the front lines, I think those are very important things to consider. The third, I think we heard some of those things earlier around data integration. As you know, a few months ago, the US government suspended, some of the funding that goes towards TB, AIDS, and malaria. So there's a shift in global financing. We did an inventory analysis and found that, roughly $600 to $700 million was really spent on TB, AIDS, and malaria. The government responded with $200 million in terms of domestic resource mobilization. So the importance of the efficiency gains is quite important, and the role of digital in enhancing integration of TB, AIDS, malaria, surveillance at the front line, and efficiency more broadly is quite important. Also, as part of MAMI, these local governments are typically in underserved areas. So the innovations in service delivery, how to whether it's telemedicines or responding to the sorts of defragmented networks of care that we have at the front line, I think is also quite important. And so over the years, digital health efforts have largely been donor dependent and fragmented. I think through our reform, we are calling to go from fragmentation to harmonization, from aid dependency to more sustainable local investments. So for us, it's not just about funding, it's really about ownership and leading our own agenda, which we call the One Plan. It ensures that solutions are designed with Nigerian realities in mind, scalable, culturally appropriate, and aligned with national priorities. So for us, this is really an invitation to respond to some of these priority problem statements, to scale towards 17,000 BMONC facilities, 774 CMONC facilities, hundreds of thousands of community workers that need to with this national blueprint. and the NDHA, and let's build a unified system together. Let this forum spark the source of collaborative innovation that is grounded in our national architecture, and we encourage participants to explore how local financing can drive digital public infrastructure, ways to align innovations with the Nigeria Digital Health Initiative and National Digital Health Standards, and opportunities to strengthen state-level ownership and cross-sectoral partnerships. I'll just close by reaffirming the government's commitments to enabling a thriving digital health ecosystem. And on behalf of the Coordinating Minister of Health and Social Welfare, Dr. Mohammed Ali Pate, I think we reinforce our commitment to build systems that not only work but last, systems that are not just smart but are truly inclusive and leave no community behind. Thank you again to eHealth Africa for convening the important meeting.
Thank you again. A round of applause for Dr. Muntaqa Umar-sadiq.